My name is Dr. Eldred Taylor. I'm an obstetrician gynecologist. I went to undergraduate school at Vanderbilt University in Nashville, Tennessee. I did my medical school training at Emory University in Atlanta, Georgia, and I was chief resident of OBGYN during a 4-year residency also at Emory University. Since that time, I have practiced what you would call conventional OBGYN for approximately 7 of the 13 years that I've been in practice. At the end of that 7 years, I became very distraught in what I was doing because I felt like the majority of my job was to deliver babies. I performed pap smears. I prescribed birth control pills and hormone replacement. And I did that over and over. And what I found out was that I was not helping patients like I wanted to. And what really got me involved in this and trying to find out untold truths is because my wife was dealing with the difficulties of PMS and what I now know to be problems with estrogen and progesterone imbalance. And after I started listening to patients and they were telling me about different things that they were doing, as in taking herbs and using creams, and it was seeming that it was helping a lot more than what I had been prescribing, which were birth control pills and hormone replacement. And I started studying and listening and investigating, and I found that there was a whole new world that concerned itself with hormone replacement that I was not aware of. And after trying to utilize these things in my wife, I found that I could get tremendous benefit by changing diet and lifestyle, using herbs, using progesterone creams. And I became so excited in this that I actually received some formal training by going to a University of Naturopathic Medicine, and I've also completed about 200 hours of continuing medical education on integrative medicine that combines conventional and alternative medicine in order to try and treat the whole person and not only treat them as a disease that can only be corrected with pharmaceutical medications. So that's my background, and as a physician being conventionally trained, I felt like the focus on the training that I had was that every problem in a woman was due to lack of estrogen, which I think is a 180-degree difference from what I know now. If you understand the menstrual cycle, and that's what you have to understand, and I think because we try to put everything in a small box, we don't understand the fundamentals, and the fundamentals is the menstrual cycle. And the menstrual cycle is based on a balance between estrogen and progesterone. Estrogen in the menstrual cycle makes tissue grow in the uterus, it makes follicle grow in the ovary, it makes breast tissue grow, and that all happens in the first part of the menstrual cycle. In the second part of the menstrual cycle, you make progesterone, and progesterone stops growth, calms things down, calms the brain down, calms the breast down, calms the uterus down, and it calms the patient down. And so because we don't understand the menstrual cycle and the balance between the menstrual cycle, we haven't understood the balance between estrogen and progesterone. And if you look at estrogen dominance and the symptoms caused by estrogen dominance seems to cause PMS. It causes abnormal growth of the breast, as in fibrocystic breasts. It stimulates breast cancer. It causes weight gain. It causes perimenopausal symptoms. It causes symptoms associated with thyroid problems. And so because we didn't understand the balance of estrogen and progesterone, we have literally overloaded the entire population on estrogen by giving anyone less than 45 years old with any type of what we suppose is a hormone problem birth control pills, and anybody over 45 we've tried to prescribe them estrogen and estrogen replacement, and we have made the problem worse instead of better. As an example, with my wife would have an awful time 2 weeks before a period. My wife is a psychiatrist, and so her job is to go in and help patients with their problems. But my wife was having significant problems on her own for the 2 weeks before her menstrual cycle. She was having weight gain, bloating, breast tenderness, irritability. She was having trouble dealing with stress. She was snapping at our kids. My little son, who was about 4 or 5 years old when I first discovered this, at certain times of the month, he knew not to bother Mommy. I would tell him, Mommy will snap if you go and ask her for something, so you need to stay away. So even my 4-year-old was aware of PMS. And so what we did was we tried remedies that would increase her progesterone and decrease her estrogen. And how you decrease estrogen is you need to have a diet that does not cause overstimulation of estrogen production or decrease the amount of estrogen that you can metabolize. Diets that are high in fiber help you to decrease your estrogen load, because the way you get rid of extra estrogen is through elimination of bowel. We have an epidemic here that patients think that having 1 to 2 bowel movements every 2 or 3 days is sufficient. But if you don't eliminate your bowel, estrogen will be recirculated. So that increases estrogen overload. So a higher fiber diet helps with estrogen load. Having adequate vitamins and minerals, especially B vitamins, help you to metabolize estrogen so that whatever estrogen you're exposed to is easily metabolized and removed from the system. So those are ways you lower estrogen. The other ways you help with that balance is that if you have an imbalance, you can either decrease something that's high or increase something that's low. Progesterone needs to be in the proper balance with estrogen. And how you increase progesterone, you can take herbs that seem to increase it, which Don Quai and Vitex or chasteberries or some of those herbs. Or you can actually use progesterone, and the best way to deliver progesterone to your system is through the skin. And that's why progesterone creams seem to work very well by restoring that balance between estrogen and progesterone by delivering progesterone through the skin, and you're able to increase the progesterone to be sufficient for the amount of estrogen that you're exposed to. Now, there's other ways you can be exposed to estrogen, not only from abnormalities in your own metabolism, but other ways that you are exposed to estrogen is that the foods that you eat are sources of estrogen. Estrogen is known to increase fat and to increase water retention. The cow and chicken farmers have known this for a long time, and so they add estrogen to their cattle before slaughter and also to their chickens before slaughter to increase the breast size of the chicken and also increase the weight of the chicken and the cattle in order to get more per pound at slaughter. Estrogen is a very resilient hormone, and so when you eat these meats that have hormones in them, you're increasing your estrogen load. So you need to be aware of this so that you can purchase free-range or hormone-free meats so that you can help control the balance of estrogen and progesterone. As I stated before, there's several ways that you can be overexposed to estrogen. We talked about diet, we talked about metabolism, but one other area that's almost impossible to avoid is the environment. There are estrogens called xenoestrogens in the environment that are rampant. Xenoestrogens are man-made estrogens, and a lot of pesticides that are commonplace, some that are banned and some that aren't banned, behave very much like estrogen. And these estrogens, these xenoestrogens, can be 10, 15, 100 times stronger than estrogens that are manufactured in the body or produced in the body. You may ask, why would the FDA or the Environmental Protection Agency allow this to happen? Well, what seems to be the problem is that these are all tested individually. There may be a certain maximum amount of pesticide or xenoestrogen that is acceptable, but the problem is there's so many, so that you may have the low count or the below recommended amount of a certain xenoestrogen, but if you're exposed to 20 or 30 of those in a day from the pesticides, from the pollutants in the air, from the plastics, the manufactured plastics when they are out in the heat, the plastics in your car, when they have been under the heat for a long time, they emit gases that seem to behave as estrogens. So that all of these estrogen receptors are being stimulated, and they're stimulated to grow. And so they can make any estrogen-sensitive tissue grow, whether it be a breast cancer, whether it be fibrocystic breast, whether it be a fibroid, whether it be endometriosis. This continuous bombardment of these xenoestrogens greatly increase the estrogen load that you have